Occupational therapists help people recover and improve skills that are needed for everyday living tasks. My name is Jolene Albrecht, and I'm an occupational therapist at Salina Regional Health Center.
Jolene, thank you so much for coming on the show. Let's talk about occupational therapy. First of all, what is occupational therapy?
Occupational therapy is when patients have an illness or injury, and we use everyday tasks to help them regain skills and recover skills so they can do daily tasks, return to work, and even leisure activities.
So what diagnoses do occupational therapists see patients for?
Occupational therapists see inpatients and outpatients. Inpatient, we see orthopedic patients that have had back or hip or knee surgeries, as well as general weakness that have maybe diabetic complications or have had recent falls or chemotherapy weakness. Outpatients, we see a lot of elbow, wrist, and hand injuries, as well as carpal tunnel and cubital tunnel syndromes. We also provide vestibular rehab, which is therapists that are trained to treat dizziness. Also even do some pre-driving screenings for outpatients.
Do you actually give them some drills to do that they then take home and practice at home?
Yes, outpatient is very much involved with home exercise program, and then we continue to progress them through that to gain their independence of if someone needs to be able to grip a tool to return to work.
What are you looking at time frame in working with the patients for these injuries?
Well, we really do individualized treatment plans for everyone, and it's really diagnosis dependent and how motivated the patients are. You know, someone could recover in 2 weeks, or someone might take up to 6 to 8 weeks from an injury.
Obviously, it's not only you. What staff are involved?
The occupational therapy department here, we have 9 therapists, and we all work in outpatient and inpatient, crossover some. Interesting that we have 151 years of experience in those 9 people here at the hospital.
At one time you were seeing patients over at the outpatient clinic, but you were actually seeing patients at the main hospital, right?
Yes, the outpatient occupational therapy is now fully located at the main campus on the 2nd floor. You just take the central elevators, and our receptionist is right there off the central elevators to 2nd floor. But all outpatient therapy is now at the main campus.
Okay, thank you so much for some great information and for coming on the show. And thank you for watching. For more information, visit the Occupational Therapy page under the Services tab of SRHC.com. And like Salina Regional Health Center on Facebook, follow us on Twitter and Instagram.